Hello, hello. Happy hump day, everybody. It's Dr. Andrea coming on to talk with you guys tonight. I hope you guys are making it home safely from work. I'm just getting in and getting set up to talk with you guys this evening. Going to try to wait just a moment or two for you guys to join in tonight when we talk about this topic about breastfeeding. Hope you guys have been having a great week. It's not raining too much this week, which is great. I think the hurricanes are finally moving away. All right, so just to introduce myself, my name is Dr. Andrea. I am your board-certified pediatrician and newborn expert. And basically through my online videos, my teaching, my clinical practice, I basically help new and expectant parents feel more empowered, prepared, and at ease. And today I'm coming on and talking with you guys about breast milk, booze, and lattes. So basically a common question I get at the office or just from new parents in general is it okay for me as a breastfeeding mom to go ahead and have caffeine or alcohol in my diet? So I kind of wanted to come on here to talk with you guys a little bit about today to answer those questions, let you know, is it okay? If it is okay, what is okay and what's not okay and what to look out for. And again, today we're talking about breast milk, booze, and lattes. A breastfeeding mom having caffeine and alcohol in her diet, is it okay or not? So let's kick it off and talk about caffeine. So the question first is, can you have caffeinated beverages or caffeine in your diet and breastfeed? The answer is yes. Generally, it's expected that having caffeine in your diet to some extent is okay. So can you have too much? Absolutely. You can have too much caffeine, although you can have some. Hey there. Hey, Bobby. So what are some things, let's first talk about, so we'll know, hey, sorry, my dog. What are some things that will show you that maybe the baby is getting too much caffeine in their diet? So some things that you want to look out for are going to be a baby that's more irritable. They can be fussier than their normal levels. They may be jittery. So if you've ever had too much caffeine, because I certainly have, you feel a little bit shaky. Same thing can show up in your baby. So if your baby's shaky, irritable, fussy, those can be signs they're getting too much. If they're having poor sleeping habits, poor sleeping habits can be a sign of too much caffeine. And then even in some babies, this is not as common, you may see more frequent or looser stools. And anyone that's ever had some coffee in the morning, regular coffee drinkers, you know what happens. So keep those things in mind. But a big thing about this is knowing that every baby is different. So some babies may tolerate more caffeine in the diet, other babies may not. So every baby is going to respond differently, okay? So question, how much caffeine can you have? So typically it's thought to be safe if a mom that's breastfeeding has the equivalent of about 2 to 3 cups of coffee a day, which is typically about 300 milligrams of caffeine. That's 2 to 3 cups of coffee, that's an 8-ounce cup of coffee, which equates to about 300 milligrams of caffeine a day. So people drink more than just coffee, right? There's lots of different things. So let's break that down a little bit. So your typical cup of coffee typically ranges somewhere between 100 to 150 milligrams of caffeine per cup. So you really have to pay attention to what kind of coffee you're drinking. When it comes to your espresso drinks, those can have typically per shot 75 milligrams of caffeine or less. So if you're thinking about a tall or just a shot of espresso, that's usually 75 milligrams. But if you're having a double shot or a grande, you're doubling that up, double that number, okay? When it comes to your teas, your black teas, your green teas, typically those are going to be 50 milligrams or less. Your soft drinks, especially those high ones like a Mountain Dew, can get up to 50, 60 milligrams per cup or per drink. And then when it comes to your energy drinks, those are actually pretty high. Those get up to, they're close to coffee, about 100 milligrams per cup. So be careful there as well. And then when it comes to your chocolate, those are going to be much, much less. Hey, Christy. So much, much less for the chocolate. So, but just keep it in mind if you're having a lot of it. Okay, so again, 2 to 3 cup equivalent of coffee a day or 300 milligrams of caffeine is thought to be okay. Now, studies do show that if you have a little bit more than this, you're generally okay. But if you're getting much over those 5 cup equivalents, closer to more than that, you can run into some issues. So the next question is, how should you drink this coffee? This is important too. So you can't just slam back 2-3 cups of coffee because the coffee will start building up in the body. So about 1 to less than that % of what you drink in caffeine will go into the breast milk. But if you're drinking it back to back, it's going to build up to higher levels, and it can take about 4 to 5 hours just for that to start clearing out of the breast milk. So you have to be cautious with that and spread it out maybe like a few hours in between each cup throughout the day, even though you can have a few cups a day. And keep in mind, a baby that's younger than 5 months old, their liver is immature and it doesn't work as well as babies 5 months and up and adults. So their liver won't get rid of that caffeine or alcohol as quickly as an older baby or an adult would. So if you have a 1 month old and you're drinking this coffee, it's going to build up to higher levels in their body for longer than if you had like a 6 month old or a 9 month old. So keep that in mind too, and look out for those symptoms that we talked about. So that's how you want to drink your coffee or your whatever your drink is. Spread it out through the day. About 2 to 3 cups of coffee equivalent, 300 milligrams is typically seen to be okay. And then always, again, pay attention to your baby. You do not need to pump and dump. It's safe to breastfeed and have the caffeine. But if you wanted to know, typically about an hour to between an hour and 2 hours is when the caffeine level will peak in the breast milk, and then it will slowly go down after that. So if you just wanted to avoid it in general with your baby, you can, but you do not need to pump and dump. Just wait a few hours and then breastfeed later, okay? Any questions about caffeine before I move on to alcohol? If you have any questions, throw them in the chat for me. About anything else, I can get to those later. But if you guys don't have any questions about caffeine, if I need to clarify anything, let me know. We'll move on to alcohol. The funner one, no. Kidding. All right, so let's talk about alcohol. So number one question, can you have alcohol and breastfeed? Yes, you can. Can you have too much? Absolutely. A little caveat. Talking about alcohol can be a little bit more controversial. There is no true safe amount of alcohol that you can have while breastfeeding. It hasn't been proven that it's safe, but there are amounts that in studies have shown to be likely to be safe, and that's what we're going to talk about. And when you're talking about alcohol in general, when you're talking about someone that's more of a habitual drinker or a chronic drinker, that's when you can run into more issues, and when there have been studies showing that it can lead to issues in the baby as they get older. Okay, so keep that in mind throughout this whole talk. So the alcohol, can you have it? Yes. Can you have too much? Absolutely. So what are some things that you can look for in the baby if they're getting too much alcohol through mom's breast milk? So the baby can be similar to a baby with too much caffeine. They may be more agitated. They may be irritable. They can also show poor sleeping habits. Another thing is a lot of studies show that babies that are drinking breast milk where mom's been drinking alcohol, they actually get about 20% or so less milk when they're drinking. And the mom typically doesn't even realize it's happening because the baby will suck the same typically, but then later on they tend to eat a little bit more to catch up, and they're just not getting as much milk, and it seems to decrease the letdown of the milk that's coming from the mom. Now, if you have a mom that's drinking a heavier or a bigger amount of alcohol, you can start seeing things like sedation, so where it depresses the nervous system, where the baby's not as alert. It could affect their sucking. It could affect their breathing. This can be very dangerous for a baby if it's too much alcohol. You can actually see that the baby will start retaining too much fluid. And now babies have to have just the right amount of salt and fluid in their body, so if they retain too much fluid, they could actually be at risk for seizures and other things like that. So overall, you want to be careful. It can affect their hormones. So heavy drinking can cause much more significant problems, but some lighter drinking, if you're getting a little bit too much of the baby, can cause that agitation, poor sleeping habits, irritability, things like that to look out for, okay? So just we want to be very clear. So let's go back to how much typically is okay. So typically, the equivalent of 1 preferably, or up to 2 at the most, servings a day of alcohol is considered to be generally safe. So what is a serving? 1 serving, is there a limit that dads can drink? Yes, and I'm glad that you said that. So let's go to another point. So no matter what, when you're drinking alcohol, dads, moms, any caretakers, a big thing that you want to remember is just because you can drink it doesn't mean it's a good idea, okay? So you're there caring for your baby, and you need to make sure that you are still able to care for your baby, that you're not going to drop them, that you're going to be alert and aware. And if you're not going to be able to do that, you need to have someone else there that can do that for you. So thank you for saying that. Hey, Alicia. All right, so going back, what's safe? So typically it's thought to be safe to have about 1 serving to 2 servings of alcohol a day, okay? Going over is not considered to be significantly safer like caffeine. 1 to 2 a day. So what's the equivalent? So 1 serving would be 12 ounces of beer, 1 ounce of liquor, or about 4 ounces of wine. Hey, so that's going to be your 1 serving, okay? And then of course 2 servings, there's that. So then how should you drink this alcohol? So when it comes to drinking alcohol and breastfeeding, question is, do you have to pump and dump? You do not have to pump and dump, but you want to pay attention to how you're drinking the alcohol. So what I recommend for the caffeine, but mostly for the alcohol, is if you're going to drink, go ahead and breastfeed your baby right before you're going to have the alcohol, okay? Right before, so that way the clock starts ticking then. I also recommend that you have some breast milk pumped and saved somewhere else in case you aren't able to make it to the limits I'm about to talk about. You have some breast milk that's available for your baby if they get hungry, okay? So go ahead and feed right before you drink, and then have some extra breast milk pumped and available for you in the fridge or somewhere else, okay? So when you have the alcohol, it peaks about 30 to 60 minutes after you have it if you're taking it on an empty stomach. Now, if you are drinking this alcohol and having food with it, it can significantly lengthen the duration of the alcohol content in the body and in the breast milk. Now, with caffeine, only about less than 1 to 2% of the caffeine goes into the breast milk. With alcohol, it's not like that at all. It's pretty much equivalent to the blood level, and your blood, that level of alcohol is pretty much the same as the milk, the breast milk, okay? So you really want to be more cautious. So it peaks about 30 to 60 minutes on an empty stomach, longer when you're eating food, okay? So once you've had your drink, say you finished it, a clock is going to start, and for each serving of alcohol, you want to wait about 2 to 2.5, 2.5 is going to be more conservative, hours before breastfeeding your baby. So if you finish at noon, 2:30 is about the time you want to breastfeed. And that alcohol that went into your breast milk will be reabsorbed back into the body, and typically about 2.5 hours, most of it will be gone. Now, something to keep in mind about that is a lighter woman, so a woman that's maybe like 120, she takes longer to metabolize to get rid of the alcohol in her body than a woman that's maybe 160 in weight. She will probably be more towards the 2 hours, but the lighter woman will be more towards like the 2.5 hours. So keep that in mind. Another big question, what if I have more than 1 drink? Yeah, so definitely, if you have 3 servings of alcohol, guess what? That's 6 to 7.5 hours that you have to wait from the time that you finish drinking on an empty stomach till you can breastfeed again. So it all adds up. So 4 drinks, 8 to maybe 10 hours that you have to wait. So certainly if you're planning on doing that, I wouldn't do that frequently at all, but if you just had one day where you're gonna drink with your friends, have some milk supply saved up, and do not breastfeed for that long amount of time. Any questions about that, guys, at all? All right, so we've covered how much you can drink, how you should drink it, definitely pumping beforehand. Let me go back one more thing I forgot to say about the caffeine. So you can have those 2 to 3 cups, but keep in mind for breastfeeding moms, if you go over 2 cups regularly of caffeine, that acidity of the caffeine can actually lower the content of, it's thought to lower the content of iron in your breast milk. So if you don't have a good iron level and it lowers the iron in your breast milk, it could put your baby at risk for iron deficiency anemia, especially as they get closer to the age of 1. So if you're doing that regularly, make sure that you're thinking about supplementing. No, you don't have to do that. Nope. And I'm glad that you brought that up because a lot of people ask that question. But yeah, definitely with the iron, make sure your baby's getting some iron-rich foods if they're old enough to eat, or that you're supplementing yourself with iron to make sure that if you're having that caffeine, it's not leaching it out of your breast milk, putting your baby at risk. So overall, again, a couple key points when it comes to the caffeine: 2 to 3 cups a day, 300 milligrams of caffeine is thought to be pretty safe. But watch your baby, watch for those symptoms that we talked about, the irritability, the poor sleeping, the jitteriness, the loose stools. Every baby's different. Younger babies are going to take longer to clear things out of the body, so do not drink back to back to back with the caffeine or the alcohol. You're really going to be putting your baby more at risk of having symptoms, especially with the alcohol, which can be more dangerous. But you do not have to pump and dump as long as you wait an appropriate time. And again, for that alcohol, for each serving, 12 ounces of beer, 1 ounce of liquor, 4 ounces of wine, about 2.5 hour waiting period, okay? And remember, if you're eating food, it is going to take longer for that to leave your body, okay? So if you're eating food with it, you're drinking a couple drinks, go ahead and extend it out further and just have some pumped milk that you already have saved and ready for your baby. I think that is everything. Let me take a peek at my notes. I don't want to forget to tell you guys anything important, but I think that was it. Any questions at all from anybody? I hope this was helpful. I hope that you guys share this video with your friends, because I know a lot of people have this question and they worry. Again, these are the best things that I could find available as far as the safety goes. There's no set hard rule. Always err on the side of caution, and remember, look at your baby. You're the parent. If you feel like something's wrong, you feel like it's too much, back down. And when it comes to caffeine, actually, if you're worried that your baby may be getting too much, it typically takes about 4 days or longer to tell a difference. So if you feel like you were having 4 cups and maybe you want to see if 2 is better, cut down to 2 and wait about 4 or 5 days to be able to tell a true difference in your baby. And then when that caffeine has fully left their body, you should be able to tell if it was having an effect or not, okay? Always err on the side of caution. Again, I'm Dr. Andrea. Thank you guys for watching. If you'd like to follow me, you can follow me on my social media at Dr. Andrea MD. That's DrAndreaMD, or at my website, www.drandreamd.com. Thanks again. Have a great evening, guys. Bye-bye.